And YouTube says I am now live. Here we are on Sunday evening, and it is the 20th of March, a Sunday. And what I'm talking about this evening is about the big news in Ontario tomorrow that is causing a lot of tongues to flap, and that is that our masking mandate is coming to an end. So again, it's Gordon Causey, Northumberland County, southeastern Ontario. All excited I am over the fact that the Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, and the Ford government have declared that as of I assume it's as of midnight tonight, but certainly as of tomorrow, Monday, masks in most indoor public places will no longer be required. So you'll be able to go to the grocery store, the most indoor public places, and not have to wear a mask. We've had this rule in place now. I don't remember exactly when it was instituted, but I believe it was sometime in August, July or August, sometime in the summer of 2020. So we've been more than a year and a half of whenever going out into an indoor public space, you had to put on one of these or one of these. I always opted, my choice was this clear plastic thing. I refer to it as a mingle mask, although that's a brand name. And this one I picked up at a dollar store. The rules were always that basically you had to wear a mask or a face covering, and it had to cover the nose and the mouth, which this little flimsy piece of malleable plastic covered. So you can wear one of these. You can wear any number of things. I've linked a video below. I mean, This Hour Has 22 Minutes, which is a CBC comedy show, did a little skit on it where they had 3 or 4 people walking into a store and they'd all forgotten their masks. So one was wearing a Tim Hortons coffee cup strapped to his face. A woman was wearing the cup from a brassiere, and I believe one guy was wearing a jock strap. And, but so long as your nose and mouth are covered, it was legal. And the one thing is, well, I'm excited, and a lot of people are. Kids will no longer have to wear masks in school. I know that a lot of people are hyperventilating over it as well because they're afraid that it's going to lead to increased rates of infection. I know that we've had the masking mandates in place, as I say, since I believe it was August of 2020. And from August 2020, more over the course of the past year and a half, infection rates would go up, they'd come down and up and down. Perhaps it was seasonality. Respiratory viruses historically have been said to spread, during flu season, basically October to March area. But then there are also new variants would emerge. We've had Delta, we've had now Omicron. Now there's a sub variant of Omicron. So, is it because of laxing the measures? Is it because of an increase of transmission of respiratory viruses in colder weather? Is it because of new, more transmissible variants? There are just so many moving pieces that in my mind, to say cause and effect. And so I wanted to address those who are hyperventilating, for lack of a better word, who are concerned over the laxing of the measures. And I wanted to bring up something that was basically ignored by the media completely. I didn't see one article written on it. And it's from January of 2021, so more than a year ago. A letter was sent by the Ontario Nursing Association representing their, I'm going to read the letter, and it'll cite how many healthcare professionals they represent. And they were concerned about something called airborne transmission, or aerosols. And the fact of the matter is that in March, April, May, when everything started, the primary transmission vector was viewed to be spittle, and there was some controversy. Some individuals started to suggest that they believed it was airborne. That was pushed down, but as the summer wore on and into the fall, airborne transmission gained a lot more traction. And by the time this letter was written, airborne transmission was pretty much firmly well established. It's an airborne virus, meaning that it's not just respiratory droplets, which are basically, I use the word spittle, but they're large droplets that are emitted from your nose and mouth when you're breathing, talking, singing, coughing, sneezing, whatever. And because of gravity, they would fall to the ground within about 6 feet, and hence the 6 feet social distancing or physical distancing. I don't like the word social distancing because there's nothing social about distancing. That's something of an oxymoron in my world. So this 6 foot, 2 meter physical distancing was based on this view that the primary driver of transmission was respiratory droplets. But by, it was well established by January of 2021 when the Ontario Nursing Association wrote this open letter to Doug Ford. And this is significant because for individuals who are concerned about masks, the one thing is, anyone who's worked in any trade knows you need the proper tool for the job. Can you use a knife as a screwdriver? In a pinch, it'll do the job, not very well. You might ruin the screwdriver. You might strip the screw. You might end up doing more harm than good by using the wrong tool. So anyway, here's what the Ontario open letter. And again, this was from January 25th of 2021, so over a year ago. Dear Premier Ford, and again, this is from, I'll tell you who signed it. This is written from the Ontario Nursing Association, but it's from Vicky McKenna, registered nurse and the president of the Ontario Nursing Association. And she wrote to Doug Ford in an open letter saying, Dear Premier Ford, I'm writing an open letter to you on behalf of the 68,000 nurses and healthcare professionals on the front lines of Ontario's response to COVID-19. On November 26th of 2020, you were copied on a letter that I wrote to the Chief Medical Health Officer of Health, urgently requesting that Ontario's directives and guidance be revised to recognize precautions for airborne transmission of COVID-19. ONA advised Dr. Williams that aerosol transmission is now well established by several public health agencies. Premier, nurses and healthcare professionals can wait no longer as they continue to become infected with COVID-19 at record rates. It is surprising that a developed jurisdiction like Ontario is experiencing such devastation. It is not inevitable, but it is preventable. Nurses and healthcare professionals expect urgent and decisive action, that you and the government immediately update your directives and guidance to mandate precautions for airborne transmission, including the use of N95 respirators for all nurses and healthcare professionals who come into contact with any suspected or positive COVID-19 patients, residents, or clients. As you have been advised, the Public Health Agency of Canada recognized on November 4th of 2020 that SARS-CoV-2 is transmitted by fine aerosols as well as by larger respiratory droplets. PHAC's position was updated to be consistent with an earlier change made by the Center for Disease Control and Prevention, CDC. They made theirs back on October 5, 2020, which recognized that COVID-19 can be spread by airborne transmission through exposure to virus in small droplets and particles that can linger in the air for minutes to hours. And as a side note, so aerosols are said to be able to travel as many as 30 feet, can linger in the air for hours depending on the humidity in a room, and they can even get into ventilation systems. So returning to the letter. As well, the World Health Organization has updated its guidance to include transmission via aerosols. On January 4, 2021, 63 scientists, occupational health specialists, engineers, physicians, and nurses from across Canada called on the premiers and on public health officials from the federal, provincial, and territorial governments to recognize airborne transmission of COVID-19 and to act accordingly. This is a significant shift and has implications for healthcare worker protections, since only N95 respirators at a minimum or other superior respirators are designed to protect the wearer against aerosol transmitted diseases. Surgical masks do not protect against this mode of transmission. I'm going to repeat that. Surgical masks, like I'm holding up now, do not protect against this mode of transmission, that being airborne aerosols. Back to the letter. As identified by the Ministry of Health and the Ministry of Long-Term Care, Health and Human Services, including registered nurses, are critically needed to safely manage this predicted COVID surge. They must be safe and healthy to care for Ontarians ill with COVID. The government must face the realities of healthcare workers and the perils they face. The pandemic began 10 months ago, and despite persistent infection rates and consensus on aerosol transmission, the government has still failed to act. I'll end there. There's a little bit more, another paragraph in a bit. But the point they're making, and this is the Ontario Nursing Association talking, and the World Health Organization, the CDC, and everyone else, is that this does not protect against airborne transmission. And I think you'll know why. Put one on, you got the nose clip on top. Well, we've all seen the videos of someone using a vape and the smoke coming out, even straight through, but huge amounts through the side, huge amounts through the top and at the bottom. I mean, it's not going to stop aerosols. Even this, same thing. And you've seen, and with these, because this is a cloth mask, a professional one, it's got an extra little layer here for the nose, but these get washed. And with each washing, the holes in the material that allow you to breathe get bigger and bigger and bigger. And aerosols are said to be less than a micron in size. Many of the cloth masks are said to have the holes in them that allow you to breathe are 5 or more microns in size. Now, this was a professional one that I got from work a while back. It was issued to me, made in Vietnam. How effective is it? I mean, if you can breathe through it. I used to be in the military. I would not go into the gas hut when they would put little tablets that basically send out what's akin to tear gas. I wouldn't go in there with one of these on. And obviously not this. This was my compliance. Now, a lot of people have said, well, wait a minute, surgeons wear these in OR. So I wanted to read to you from, this is from the Centers for Disease Control in the United States. And this article predates the COVID era, and I've linked it below. But it says disposable medical masks, also known as surgical masks, are loose-fitting devices that were designed to be worn by medical personnel to protect against accidental contamination of patient wounds and to protect the wearer against splashes or sprays of bodily fluids. And again, the link is down there. So these were not designed to prevent transmission of an airborne aerosol virus. A surgeon would wear these because as they're in surgery or performing medical procedures involving open wounds, and you're asking for a scalpel, retraction, forceps, I don't know, whatever. As you're asking for those things, you don't want spittle falling into an open wound. Likewise, anyone who's watched one of the old MASH TV shows, every now and again you'd see a bleeder, bodily fluids, typically blood, spraying up and going all over the gown and maybe even into the face of the medical personnel, the doctors, the nurses. And so not to prevent control of against viral transmission. Two totally different things. And so the point I simply make is that now in Ontario, you're no longer, in most indoor public places, you're no longer required to wear a mask. And I'm happy with it, but some are not. But the point I would make is that for those that are still concerned about contracting the virus, if you're wearing this, and there's another thing, PPE, personal protective equipment, has handling procedures, how it's supposed to be worn. It's supposed to be sterile. Most often you see these pulled out of someone's pant pocket or jacket pocket, totally unsterile. But if you're handling it properly, you handle it just by the ear flaps. So put it over the ears. You might adjust it very quickly. Clamp down on the nose. And there, now you're not supposed to touch the outside of it. It's supposed to stay on like this. But what do you see in the grocery store? You see this all the time. And then someone might get into a conversation and they touch the outside material, which conceivably, if it's doing its job, should, if there's viral aerosols and even respiratory droplets around, well, you've just touched them. You've just touched a contaminated surface. You're not supposed to do that. You're supposed to remove it by the strings, by the elastic on the side, very carefully. And then if it's going to be stored, it should be stored in something like a Ziploc bag or something like that, not just stuffed into a pocket and pulled back out, because what happens is now there's tactile transmission. You've got viral particles and, epidemiology 101, don't touch your eyes, nose, mouth. But people do it. We do it. Everyone does it without even thinking. Give your mouth a wipe, give your nose a wipe, little something in your eye. And now you've just transmitted the virus from the outside of that material into your eyes. And so for those hyper concerned, wear the proper type of mask, what the Ontario Nursing Association is suggesting, N95 or better, and wear it properly. The British Medical Journal published an article in 2015, and I read Colin Furness, a infection control epidemiologist with the University of Toronto. He was saying in a May 2020 article in the CBC that he recommended not wearing a mask for more than, I believe it was 2 hours a day, and it was based on that published study, which found increased risk of respiratory infections, how much it increased when people in a study that was done and where they were wearing masks for 4 or more hours a day. And so he arbitrarily picked 2 hours and figured at that point, it's time to swap out a mask, because he referred to it, not me. I'm not an infection control epidemiologist. But you can search the article. It's Masks Not Always the Answer, from May of 2020. And he was saying that after 2 hours he'd take it off, and then he wouldn't just wash it, he would boil it, because cloth in particular He referred to it as an ideal breeding ground for bacteria. It's damp, it's warm and damp, and his suggestion was that, as time goes on, the longer you wear it, bacteria is going to multiply, and at some point, eventually, you're going to start inhaling it. You'll start breathing it in, and there are drug-resistant bacteria in the world right now. So, yay for Ontario. We don't have to wear masks anymore, but you can. You're still allowed to wear one. There's no prohibition on mask wearing, regardless of the setting. But is this going to stop transmission of a viral aerosol? Is this? I know this won't. So you're no longer required to wear any of this. How efficacious it was, I'll leave that for others. What the Ontario Nursing Association was saying, that they were testing back in January 2021. They were testing positive at record rates, and they were wearing these type of masks, a face shield, gown, and gloves, and they'd been properly trained in how to use and how to handle PPE, which is what that all is. And one of the things you would notice, take off the gloves, you never let your skin come into contact with any outside material, because the outside material in a viral environment where there are aerosols and respiratory droplets swimming around, the outside material, mask, the face shield, the gown, can be contaminated with virus, and touching the eyes, nose, mouth we do it habitually, unconsciously. You don't even think about it. So anyway, I'll leave you with that. If you like it, you're welcome to hit a thumb. If you want to subscribe. If you want to share, be my guest. Happy Sunday. We're looking forward to a Monday. I am. And I may just go grocery shopping, even though I don't really need to do any grocery shopping, because it'll be just nice. And I'm curious to see what the breakdown is, because before masks were required, my spitball guess was somewhere between 10 and 20%. Out of every 10 people, I'd see one or two with a mask on before they were mandated. And I'm curious to see what it is now. I expect it'll be higher than that. I expect it might be 50-50, but we'll see. And now I can go in without having to worry about it. So again, God bless. I won't prattle on much longer. A lot shorter than my last video. Night all.